years.
Mr. Secretary, let's talk about vaccines. You've been asked quite a few questions today about vaccines. Your hearings this last week in the House as well, you've been asked a lot of questions about vaccines. You've been responding quite a bit about vaccines. I went back to look at statements you've made, I don't know, over the last 10 years or so on vaccines as well. I appreciate that you say today that you support people getting vaccine. Is that accurate?
Yes.
I was reminded, though, that July 6, 2023, Samoa 2019, August 2018, February 23rd, 2021, and the dates go on, and I have a list of them, where there was a lot of misinformation predating
Tell me a piece of information that I ever promoted about vaccines. Tell me one piece of information.
Mr. Secretary, again, if I could continue.
Well, tell me one piece of misinformation. You said I've promoted misinformation.
Thank you, Mr. Secretary. I'll get there. So, Mr. Secretary, the history shows that you were pushing vaccine misinformation predating your tenure.
Tell me one instance.
Secretary,
Tell me one statement
I just
that I
shared
made.
Mr. Secretary.
One statement.
So now, during your leadership at HHS, measles, a disease once eliminated in the United States, is on the rise in over 1,700 Americans, as you're aware. You've been asked by colleagues as well where, kids died last year as a result.
Can I answer the question?
Vaccine. I don't have a question yet, Mr. Secretary.
You're making misstatements.
At a previous hearing, you seemed to almost brag about how well the United States has fared in response to measles outbreaks compared to Mexico and Canada. I think here again today.
And Europe and all the other countries.
The United States has always been a leader, and we demand that it's a leader. That should not be a question.
We're still the leader.
Can you please tell us here today what you're going to do to reduce the number of measles cases and improve the MMR vaccination rate?
Improve the MMR. We promote the MMR. We advise every child to get the MMR. That's what we do.
Mr. Secretary, I'd be happy to just ask for that to be in the record, and I'd be happy to get a question in the record. You can respond to it.
Yeah.
I'm real curious if you're going to include funding a coordinated vaccine education and distribution campaign, for example, countering misinformation about measles and the MMR
Tell me
vaccine.
one piece of misinformation I've ever said. One statement, just one.
If I could continue, Mr.
You
Secretary.
say you have a list of them. Read one.
Tailoring outreach to communities with declining vaccination rates as well, measuring whether those campaigns are working.
You're just making things up, Senator. You're just inventing stuff. Tell me one piece of it. You say you have a whole list there. Read me one thing I've ever said.
Mr. Secretary, if you want to run for the United States Senate and get on the dais here, you're happy to do it. You should resign from the HHS today and run for office. And you can be in here, you can ask anyone all the questions you want, Mr. Secretary. I'm asking you some questions. What I just gave you wasn't even—
You're not asking questions.
Mr.
You're just making statements that are incorrect.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.